And this bilateral element cerebral palsy is also very favorite memory of mine. This is a girl who is actually our house surgeon. We are PGs. I am final year PG. My co-PG is there. He's second year. And of course, he's the intern. And she's actually coming from our hostel. We are having OP day that day. So early in the morning, she's getting ready and she's going to the wash basin to wash her face. And she finds that her face is, or her angle of mouth is deviated to one side. Naturally, she has got no disease thus far. She's a perfectly normal girl. She's only 22, 23 years old. So she's going to get really worried. There are two other girls with her in the hostel room. So they also see her. And they understand with their minimal knowledge that this is facial nerve palsy. They understand very easily it is facial nerve palsy. She does understand that she's not able to close her eyes tightly there. There is some salivary drooling on that side. So she quickly comes and meets us. She calls us up and we see her. As I see her, I tell her that there is no human involvement in this. Don't worry, clinically you are looking like Bell's palsy only. I think it is Bell's palsy. Both of us are seeing him. And we take her to our unit chief or our M6 unit chief. And M6 unit chief on seeing her tells very confidently that don't worry, it is Bell's palsy. You start steroid. And that is what he said. He didn't even ask us to evaluate even 1%. And that was perfectly fine because it was a very confident clinical diagnosis. So she got relieved. So what we did is, by the time she came, it was 8:30, 9 o'clock, the radiology department starts to function. We took her to the radiology department. In radiology department, without wasting any time, we did an MRI of the brain, just to avoid any confusion. And MRI of the brain was 100% normal, full 100% normal. So then I told her we start steroid 1 mg per kg. Okay, we were happy, convinced. And because of some luck, I don't know what luck, I just kind of, me and my colleague, we said, neurology department is on the other side of the road. So you have to cross the road and go to the other side, where 4th floor is the neurology department. So we went to the neurology department just for confirmation. Actually, there was no reason for us to go. And there we met a very close professor of ours, assistant professor of ours, Malcolm sir. Malcolm sir is a very renowned neurologist in Chennai. He's done his course from Chitra. He's very famous. So we met Malcolm sir, who himself said this looks like Bell's palsy, but he wants to do NCS. That is a difference. I don't know why he said that. And then after doing NCS, he called us and said that there is profound demyelination. This is Guillain-Barré syndrome presenting as bilateral element facial palsy. It's a very rare thing. Don't study that because it is very rare to see that way. And we had to start therapy. He said if you don't start therapy, she'll develop weakness in no time. That time she was not having any weakness. And then we had to arrange plasma exchange or IVIG. Then we decided about it, thinking of both. And then we gave her IVIG for 5 days. Had to arrange fund also. And then she recovered completely. And the fun part of it is that the PG who was there with me, who was my junior, he tried to help her out in this whole issue. And they fell in love and they got married. And she became a radiologist. She did radiology from our college itself, PG. And now she's a radiologist and he's a medicine person. And they are happily married. They have a girl child. So the whole thing happened because of this. And I'm so happy that she has got any kind of neurology symptom or any neurological illness after that. And that was because we could diagnose this on time. And that